Welcome, everybody. I'll say it again. This is the Place-Based Systemic Working and Integrating Health webinar, and we have three excellent speakers from Sport England. And we'll be doing a presentation looking at Sport England's approach to place-based systemic working and how integrating health plays a crucial role in creating active, thriving communities. And we have had a lot of interest in this webinar, so I'm very much looking forward to it. And in a moment, Adam Rigarlsford, who is Director of Place Relationships Sport England, will lead us off. And then Hannah McDonald, who's National Partnerships Lead, Health and Wellbeing Sport England, will come next. And then Ben Williams, Place Relationships Manager at Sport England, will also talk through a number of slides, and then we'll go back to Adam to round it off. After that, we'll go to questions, comments from yourselves. A couple of housekeeping rules, the usual. If you're not speaking, if you could stay on mute. If you would like to make a point, raise a question, please put it in the chat. Then I'll read that, and I may well come back to you to make that point afterwards when we get to the questions and comments part. You can also respond to other people's comments in the chat facility or to something that the speakers are saying. So, other point to note is that we do record the webinars, and after a quick edit, we put them up on the Health Equity Network platform. And what always people want to know is, will the slides be available afterwards? And yes, they will be in the format that suits the platform and the presenters. So those will be available shortly afterwards. Right, in which case, I think we're ready to begin. I'll hand over to Adam.
Yeah, thanks, Alan. Can I just double check that you're seeing the same screen as I am and the first slide is appearing?
Yep, Sport England uniting the movement.
Super, thank you. Well, good afternoon, everybody, and thank you for giving up an hour of your time this afternoon to take part in this sharing session around our approach to place partnerships in the context of Sport England strategy uniting the movement. I'm just going to share with you a bit of context before colleagues come in to talk in a bit more detail about our relationship in this work with health partners, but also then to try and bring that to life with an example of one of the areas that we're working in Calderdale. So in terms of the agenda, we wanted to share a little bit about what is the work, why we set out to do what we're doing, what kind of success we're having at the moment, the role of health in our place ambition, bringing that to life, and then a little bit about where we're going next with this. And that's quite topical actually today, because today you may have seen in the media, on TV, on radio and print and social media, that we have made an announcement of the next 53 priority place areas that we are working in a place-based way with. So lots going on the airwaves to pick up as well. I thought it would be helpful just to start with sharing this slide. We call this the bow tie diagram, and in simple terms, it sets out our approach to proportionate universalism in our place work within Sport England. We start from the premise of recognising that inactivity and inequality exists in all parts of the country, but it's more pronounced and more acute in some areas than others, and it's in those areas where we place our greatest level of resource. So on the left hand side of this diagram, you'll see in the red in the middle, place partnerships. That's the 12 local delivery pilots that we've been working with over the last 6 to 7 years in this work, and I'll come on to say a little bit more about that in a moment, together with up to 80 new places that we are identifying to work with based on a number of data and readiness factors that we've been taking into consideration. And we'll put the lion's share of our resource into those places because that's where we see the need is most acute and greatest. However, it would be wrong not to recognise that inactivity and inequality exists in all parts of the country. And proportionately, we recognise that we need to support and invest into other places as well in order to lift the whole in tackling the issues of inactivity and the underlying inequalities that exist there. And then on the right hand side, we have a much more self sort of service in terms of our Place Universal website, material sharing and learning spaces. So in terms of taking a place-based approach, the what and why, I mean, it doesn't need me to really to say too much about this slide in the context of how you'll be operating on a day-to-day basis in your own work areas to know that sadly, we have high levels of inactivity in parts of the country, and that has a significant negative impact on people's physical, mental, and social connection and well-being. And in some areas, lifespans are considerably reduced through a number of inequalities and factors that underpin that. So that really challenges us at Sport England to think about, well, we've known these stubborn inequalities that exist for a long time. And despite our individual and collective best efforts in this space, it's been really difficult to shift the dial at a population level in terms of changing behaviours and increasing people's propensity to move more and all the benefits that provides. So back in 2017, 2018, we took a bit of a pause and we developed 12 local delivery pilots, LDPs as we often refer to them. And we started from a different premise to say, well, if we do what we've always done, we get what we've always got, and that hasn't shifted the dial. So we need to think about the challenge here, the wicked issue, in a different way. And we took a bit of learning actually at the time from something that Public Health England were doing around some obesity pilots and looking at a whole systems approach in that space. And we started to look in more detail at what does a place-based approach to tackling inactivity look like, and what do we mean when we talk about whole systems? And we went on a learning journey in that space. Sorry, do we have a problem with the slides?
They're okay for me at the minute. If you carry on, I'll just deal with it through the chat.
Okay, no problem. Thank you. So we adopted on the left-hand side there, you can see the socio-ecological model, the onion diagram that we kind of fondly refer to it as, which really was a shift of emphasis for us, which said we need to look at this challenge and issue differently. We need to better understand the challenges that are going on in communities, and what does a lived experience look like? What does a place look like in terms of the policies that it creates? What's the physical environment that enables or discourages people to move more? What's the organizational implications of working in education, in the workplace, and how does that create culture within our places where we live and work that either foster and encourage or deter people from moving more? And then right the way through to our own lived experiences and the day-to-day social interactions. It's only when we understand the complexity and the entirety of that can we get a better understanding of what day-to-day life is like and what some of the challenges and the issues that face people to move more is. The last 6 to 7 years have really created a huge amount of learning for Sport England, which kind of shifts us from the people and the places report that we produced midway through that process, and then onto the right-hand side to a set of conditions we're consistently seeing in places which are creating the context to support people to make some lifestyle changes. And we recognise within all of that, when we talk about a whole system approach, that we're talking about the collaboration and the connectivity across multiple thematic areas in a place, whether that's health, education, housing, travel, transport, violence reduction, and inclusion, a whole plethora there of different issues that, when they all combine to come together to look at the context of the issues around inactivity, that we might be able to achieve something greater than the individual components. So, we've been on a journey for 6 to 7 years on that. The learning has helped inform our approach to our next phase of place development and growth. And I'll share a bit about that at the end of the presentation, what that looks like. But what we have seen over that last 7 years is that place partnerships have been able, over a sustained period of time, to start to deliver change at a number of layers of the system locally. We've started to see policies changing in places that better recognise the contribution and the value of activity to wider agendas. We started to see some resource allocation shifting to support self-supporting development and delivery in communities. We've seen a greater understanding and the buy-in to the value of sport and physical activity that's evolving. Communities are at the heart of this change. There's a really strong asset-based community development approach that underpins this work in all of the places that we work with, starting with what's strong, not with what's wrong in places. And the place and the systems in those places are becoming more connected to themselves, working to more of a common goal. joining up more collaboratively. And ultimately, people are starting to move more. Apologies, this is quite a wordy slide, but it just sort of brings to life some of the systemic change that we're starting to see, some of the ownership taking place across different layers and thematic areas in a place in terms of the buy into this work, some of the expansion of the movement, if you like, in places, which is creating the conditions for change. So you see there, example in Doncaster, a huge amount of people coming together over the last 6 or 7 years to collaborate around a common focus on tackling inactivity, and that leading to a much greater reach into communities that through perhaps our traditional routes in terms of sport and physical activity we might not otherwise be able to connect with. And then in terms of some of the if you like the data that's showing an impact here, you'll see some of the figures that we've got up here. Some of these are local Active Life boosted surveys that are giving us these figures. Some of this is national data that we've mined to demonstrate what's going on at a place level. But it's this kind of data that's giving us the confidence to expand further as we move forward and to invest more into places beyond those 12 local delivery pilot areas. So I'm going to hand over to Hannah now. Hannah's just going to give you a bit more of context in terms of specifically our approach to health and how that's connecting in here. And then Ben will bring that to life with a case study in Calderdale, which is one of our 12 local delivery pilot areas.
Thanks, Adam. Hi all. So as Alan mentioned in the intro, my name's Hannah and I work in the health team here at Sport England. Part of my role is really around supporting the work that we're doing in place, so supporting place colleagues around the sort of the health sector, as we know, is a very complex area of work and shifting pretty much as we speak. So it's quite a feat to be able to try and sort of navigate our way through this and supporting other colleagues to do it, but also being able to support our partners as well. So in this part of the presentation, I'm just going to talk to a few slides which sort of detail why we are doing the work that we're doing, why we feel it's so important, exactly what we're doing, and a few examples of how we're doing it as well. So we're sort of starting with our why, really. And I feel like pretty much everybody on this call, the fact that you're signed up to the Health Equity Network, you will sort of be converts to this way of thinking already. But just to sort of say, we are really putting place and people at the heart of our work. It feels very, very important to us. And we know that there is so much evidence which shows that the places and communities we live in are really critical to shaping our physical and mental health and well-being. As Adam said in his presentation, we know that the least active are more likely to experience poorer health and health inequalities. But there are also really some opportunities. We know that there are many and varied touch points for some of these people within sort of health and care sector that actually we have got the opportunity and the ability, the capacity to be able to influence. The work that we are doing tries to sort of create and change the conditions so that those at greatest risk of long-term health conditions are supported to be active, but most importantly, in a way that works for them. I feel like that's sort of the really sort of the needs-led lens for a lot of the work that we are doing. There is a real opportunity through our work to date, and I feel like there's an opportunity now to be able to accelerate work into integrated physical activity into health and care, even more so through working with ICSs and place-based working as well. There's a real opportunity to drive the prevention agenda through this work, but definitely requires collaboration and leadership that brings together local and national action. So just looking at the chat and the variety of people that are on this call, that really is quite heartening to see sort of the people that are interested in this work. Next slide, please, Adam. So I think this sort of brings us to our what, and I do apologise for the tiny text on this slide as well. We are really trying to sort of, I guess it's a bit of a testament to the amount of work that we're trying to do within our team at the moment. So this is a slide that sort of, it talks about the 3 main areas of work that we've identified for over the next year. So this is based on insight from previous work that we've done, but also insight from our partners and working with local places as well. So I think the main thing to sort of get across on this slide is that actually there is a real emphasis on place and integrating health and this work with place throughout all the work that we're doing. It's almost like the golden thread that sort of runs throughout it. I'm just going to talk very quickly about some of the areas that we've identified. So the first one, they're supporting place-based partners to integrate physical activity. So a lot of the work that Adam's talked about that we're doing today, working with our active partnership national organisation and working with our local active partnerships. We will also over the next year be developing an ICS framework to support ICSs on a journey to use physical activity as a tool. So really looking at sort of the key strengths within a place-based area to do that. Working with our partners, so we work very closely with NHS Horizons and OHID, specifically around our sort of our PAC work as well. And if anyone's not familiar with PAC on this call, it's the Physical Activity Clinical Champion work that we're doing. There's a great website, a Moving Medicine website, which we'll put the link into later, with loads of resources. And there's a specific place-based PAC work that's happening at the moment that may be of interest to some people on this call, and all the information is on the Moving Medicine website. Other bits of work that we're doing, so influencing policy and practices around risk, harnessing the support of key partners, so specifically around our mental health work. So for example, with our system partner Mind, who are doing some great work around their sort of system, safe and effective practice work that they're doing at the moment. Also with the Mental Health Foundation around Mental Health Awareness Week. If anybody isn't aware of Mental Health Awareness Week, it is in May this year, and the theme is community, which feels like a really good opportunity for a lot of people on this call to be able to promote about mental health. Other pieces of work, so integrating physical activity into NHS talking therapies, which I'll come on to in a minute, and also working with the National Academy for Social Prescribing to integrate physical activity. Enabling a coordinated approach to national policy influencing. So one of our large pieces of work is sort of around influencing that national policy. Campaigns wise, we do a lot of work with the Richmond group of charities who obviously work with people around sort of long-term health conditions, and in particular the We Are Undefeatable campaign, which supports those with long-term health conditions to be able to get active in a way that is most suitable for them. Next slide, please, Adam. Thank you. So I thought it was a bit of an opportunity just to do a slight deeper dive into some of those areas of work, just to talk about how we are working with, for example, our active partnerships. So we have 43 active partnerships across the country. There is an active partnership national organisation, and we fund a role within that organisation, which is a strategic lead for health role. And that role really is around sort of trying to support the active partnerships to integrate physical activity into health and care sectors, understanding the needs that's coming from active partnerships, but also trying to sort of help everybody, engage everybody to work together to create that sort of peer support across the active partnerships as well. A huge amount of work goes in from the Active Partnership National Organisation. There's events, there's webinars, there's resources, there's all sorts of bits and pieces to support place-based working through that. My second example is around the National Academy for Social Prescribing. So we know that social prescribing is one of the key links between health sector and communities, community, whether that's voluntary community sector or sort of general community itself. I feel like the sort of the ethos of social prescribing, what matters to me, that kind of conversation fits really well with this sort of place-based working ethos as well. So we work with NASP to fund a physical activity lead role to ensure that physical activity is sort of part of those national conversations. They are working in various areas. CYP social prescribing is quite important at the moment, green social prescribing, all of these connect into sort of place-based working. A sort of specific example, so NASP are currently working with Greater Manchester Moving to support local primary care networks, so very much around sort of the R's roles and active practice charter to see if there's some specific sort of more tailored local work they can do. And that's just one example of some of the work. So And my third example is working with our partners from Transformation Partners in Health and Care. So this is around NHS talking therapy. So we are now on phase 2 of this work, where we are working to sort of establish an evidence base around embedding physical activity within national talking therapy services. So phase 1, we produced some resources, a webinar, a report, some recommendations to enable people, other areas to be able to sort of embed physical activity within these services. And we're now on phase 2, where we are accepting expressions of interest from places to become trailblazers to sort of bolster the evidence base around this. So those are just sort of 3 examples of work that we are doing. And as from the previous slide, you can see there's a lot more work going on, but we are really sort of embedding this and trying to integrate all the work that we are doing within the places. So using the information from places to inform the work that we're doing, but also being able to support places with some of the national work that we're doing as well. And I will pass on at that point to Ben, I think.
Yeah, good afternoon. Great to spend some time with you. I'm going to try and showcase the place-based systemic work in Calderdale. Calderdale is a local authority in West Yorkshire, sort of feeds into the Pennines, if that gives you a feel for where it is, west of Bradford, and Halifax is the main town. It has places with high levels of deprivation. In and just north of Halifax, you've got communities in the top 10% IMD nationally, and it's also got a large South Asian community, so quite a diverse community and population. I feel a bit of an imposter sharing this with you. However, I have been working hand in hand with Calderdale for 7 years now. I've been part of their thinking, practice development and learning. That is a departure for Sport England. You know, in the past, it would have been a case of, you know, 2-3 years for funding and then tell us how you do. You know, at the end of it with a report, whereas, you know, we've actually lent into this place-based work to make sure we understand, you know, the important elements and how we can share that more widely. Calderdale, as Adam mentioned, was one of our original local delivery pilots, testing and learning how to do place-based systemic work, taking into account the unique characteristics of the place, which includes inequalities, obviously. If I can move on, Adam, please. In terms of this diagram in front of you here, some of you may well be familiar with it. It's called an influencer framework. It's a meta behavior change model akin to COMBI, if you come across COMBI. So to enable sustained behavior change, all 6 of those influences that are captured in the framework need mobilizing. So you've got down the middle, individual, social and structural, but that's motivation and capability for all 3 of those. So you've got 6 influences all working at one time. It's a framework to encourage trusted organisations to attend to the right things, to make sure that they're stimulating the right influences. Traditionally, most change initiatives mobilise the top right-hand corner. You provide somebody with a bit of training, and that enables them to get on with the work. And then you might have a strategy or a change in policy, which actually, says this is our new direction. This is important to us as an organisation. Generally speaking, that means that those kind of change initiatives aren't that successful because people tend to ignore that middle tier of social, so creating social motivation and social capability, so that's why it's important to attend to that as a key lever to ultimately affect individuals' behaviour. So if you look at and embed physical activity into the structural layer and also the social layer, then ultimately you will influence the individual. Next slide, please, Adam. As Adam mentioned, he shared the conditions that we're trying to stimulate. So through our work, we are striving to create the right conditions in places to enable inactive people to move more. Calderdale's approach to this is captured through the diagram on the right. So that's their theory of change. If you can get all 10 of the system areas that are around the edge of that that diagram in red to promote and use physical activity, then the conditions should start to help people to move. So that's the change in the place and the conditions that you're after. I always like to think of an inactive person being in the centre of that, and wherever they go, they're getting bumped or nudged to think about and supported to move more. So whether they go to the GP in the health and social care sector, the GP is talking to them about physical activity. If they go to their local voluntary organisation, that happens, and so on and so forth in all of those settings. In terms of how they categorise and how they play across to the influencer matrix, the ones or the 5 that are boxed in by blue, they're the social influencers, or I suppose another way of describing it are the actual demand creators, actually getting people to think about what physical activity could be for me. Whereas the yellow ones are more the sort of structural, environmental opportunities for people to move more. So that ties back into that influencer matrix. Next slide, please, Adam. Some of you might be again familiar with this, but our national evaluation and learning partner for our place-based systemic work, using the learning from places, the places we've been working with, has developed a conceptual framework to summarise what place-based systemic work is. The framework has 3 layers to it. So it's system integration, community development, and tackling inequalities are broadly those 3 layers. So Coldale's approach is system-led and community-led, which sort of plays across to that conceptual framework. So there is vertical integration and embedding of physical activity into trusted organisations, which is then connected to places of greatest need through community involvement and development. Thanks, Adam. I'll apologise, it's a bit of a busy diagram, but I'll unpack it a bit for you. So in terms of Coldale's most recent framing of the work is that they're very much using this frame of we're all active Coldale, so all parts of the system are leaning into supporting people to think about and be more active. And in terms of how they're doing this, they're trying to ensure that physical activity use and promotion is embedded into their policies, working practices, and delivery, and that's done through co-design with the audience and with community involvement. So that they're important elements that have been used pretty consistently through the LDPs, and the progress is tracked through proxy measures of changes to policy, changes to working practice, and increasing workforce capabilities. So moving medicine training for frontline workers, for instance, increased community involvement. So more people from the community are actually shaping and making decisions. And there's evidence of more cross-boundary working. So Adam mentioned earlier about the system being more connected to itself. And that's all focused on changing the behaviour of the system. So that ultimately those organisations are doing that on a self-supporting basis. They don't need any stimulus from anybody else to carry on promoting physical activity. Thanks, Adam. So in terms of the community-led approach, you can see, and I think Adam mentioned earlier in terms of our national approach, but it's applied in Coldale as well, is that Marmot's proportionate universalism is used. So they've identified 10 priority neighbourhoods, and that's based on IMD primarily and inactivity data. And in terms of that, the kind of things, I suppose, the ingredients they're looking at, which are captured there, are building on what's strong, again, what Adam mentioned earlier, forging relationships, which is absolutely critical to the work. So it's not a transactional in and out relationship. There's also more opportunities to be available locally, and they're co-designed and produced. Empowering communities to make decisions, as I've touched on. Building confidence, skills, and capacity in the community to become more self-supporting, and then joining up the vertical work in those places. So getting the sort of broader services in the place to lean in. So how does that look in a place? Well, if we go to the next slide, Adam. So this example that they've used where they've done some very focused work in one of their priority communities, one of the 10, is Mixenden, which is in North Halifax. It's got, as it says there, a population of 5,500 people, 70% of which are in the top 10% IMD nationally. If you think back to the theory of change, this is all about mobilising the assets in the place that can encourage and enable people to move more. The social and structural influences mobilise, so moving becomes the norm in Mixenden. And you can see, those red circles around their theory of change are reflected in the different agencies and how they've been mobilised in the place. Next slide, Adam, please. So, as you say, and everyone's playing their part. So you've got the health and social care leaning in, and you can see with the bullet points the kind of interventions that are happening there to encourage people to think about physical activity, but then also connect to community opportunities and the voluntary sector and educational settings. Next one, Adam. This slide summarises the outcomes from where we're all active Calderdale, and they're on the left, so the direct outcomes from the work, and on the right it shows how that connects to Sport England's sort of long-term 10-year strategy, Uniting the Movement. So our 4 KPIs. The why use physical activity to improve the well-being of local people is broader than that. So physical activity is unique because it is, and I'm talking broadly because those exceptions, but it's preventative, it's accessible, it's inclusive, and it's sustainable, or it can be. And I suppose that in terms of the benefits of the approach, which aren't reflected on here, but certainly are important locally as the reasons why, and a lot of you work in this field, so I'm sure these will all resonate. You've got social inclusion and resilience, reduce social isolation, increase skills and employability, create better places to live, and more sustainable communities and places. So that's just supporting the wider social, economic and environmental well-being of Calderdale. If I go to the last slide for me, Adam, please. So this is from the investment that's gone into Mixon, but I suppose it did make me think when I looked at it about a couple of Myron's maxims. I don't know if you've come across that, but systems leadership. So connecting the system to more of itself and the benefits of that, and also the process you use to get to the future is the future you get. Investment in communities can be optimized if you work in partnership and collectively, and to ensure that you're delivering the best outcomes for the investment made that is actually meeting the I can't even think of the right word, what the community say that they want. So it's been driven by the communities. So if you look at that slide on the left, the diagram shows that Active Calderdale, and that's largely through our investment, have invested 174k, but that has drawn in a number of key partners in that place to ensure that the promotion of physical activity and support given to people to enable them to be active through active environments has leaved in a further 585k. So a more joined up and long-term sustainable approach. So hopefully that brings Calderdale to life, and I'll hand you back to Adam.
Yeah, that's great. Thank you, Ben. I'm conscious we've shared quite a lot of information there. I've just got a couple of final slides, really, just to set the context of how we're moving forwards, and then we'll have hopefully 15-20 minutes with Alan facilitating to go through some questions. I can see things popping up in the chat, actually, and if we don't get to all of the answers in the remaining time, Alan, I'm more than happy to take those away and to provide some further responses and links in that regard. So I thought it would be helpful just to sort of set what you've heard so far from colleagues in the context of our ambition moving forwards. Back in March 2023, our Sport England board made a decision taking on board the learning from those 12 local delivery pilots to invest a further £250 million of our budget, which is about 25% of our overall budget, to take the learning and expand it into new places. 8,200 initially. We've talked about that, and we're launching 53 today. We've got another 23 in the pipeline that we're working behind the scenes with at the moment to discuss the interest in the approach. Alongside that, we're deepening in those initial 12. So one of the key things that we heard very loud and clear when we started off back in 2017, 2018 was the tensions that there were in communities around short-term funding and short-termism, in terms of the lack of trust that often created between communities and public sector bodies in places. So we've taken that on board, and in our 12 pilot areas, come 2028, we'll have been investing for a decade in those places, creating and strengthening the system that supports and scaffolds people to be more physically active and move more. In the context of the 12, we're putting up to a further £35 million into those areas. You can see on the right-hand side, not very clearly, but you'll see it when you get hold of the slides post the event, of where those 12 local delivery pilots are. I know there's some people on the call that are actually involved in those already, so there'll be a degree of familiarity. For some others on the call, that will be something that's new. And then, as I said earlier, we're expanding now into initially 53 areas, which we've got a development process going on, and that they've been announced and published today, and a further 27 that we will be bringing on board in the coming months, together with a place universal offer, which, going back to the bow tie diagram I shared at the start of the presentation, enables a proportionate support element to be provided in other places that aren't going to be part of that 80 and those 12 deepening areas that we're honing in on. And you can see here, actually, I'm at the National Centre for Voluntary Services in London today, because we're bringing together a network of facilitators from a range of expertise around the country that will be able to work with more closely to support other places in their thinking and their approach around this work. So I'll pause there. Hopefully you found that helpful, and I'll hand back over to Alan. I'll take my screen down, Alan.
Absolutely. Thank you very much, Adam and Ben and Hannah. Excellent presentation, lots of information there, and great to see all the interactions on the chat as well. So we'll go quickly to invite Richard Blackwell, if you'd like to come on screen and unmute, and excellent question that you posted early on.
Hello. Yes.
Go ahead.
Thank you. Afternoon all. Adam, I was just wondering, when I look at those play spaces, they are pretty much sat within high density population areas. So you can see the sparseness, where there's sparse populations, Cumbria, Lincolnshire, West Country, there's not much going on down here. And it's one of the things that I'm battling with quite often, which is we go for economies of scale, we go for greatest impact, which is invariably where the population is. But is there any way that we can help balance this inequity around the sparsely populated areas? Because that always seems to be a bit of a challenge. Now, I'm not wishing to give solutions on this, because I certainly don't have them, but one of the things which I'm thinking of is almost trying to create those communities of practice across the country, where you might have, so just talking about what's the place, Mixenden, they've got this, if you look at its semi-unskilled workforce according to the output area classification, I have the same in Ilfracombe, I have the same in Barnstaple, I have the same in Redruth, I have the same in Camborne. It would be nice if we could get that sharing of learning, so even if the money went into one place, the knowledge could come out into other places.
Yeah, great question, and great challenge as well, Richard, so thank you for that. Yes, I mean, hopefully you'll see today in the announcement of the next 53 places we're working with, we are leaning more into recognising some of the points that you've raised, particularly rural communities as well. So we are moving into areas of Cumbria. We have got a number of areas in Lincolnshire, and indeed in parts of the southwest we're also expanding into as well. And without going into, we're not in a position to publicise published the 27 that are coming after the 53, but I can assure you that we've done some analysis of where those 53 are and take and look to make sure that we get a bit of a counterbalance in the remaining 27, where we think that we have inadvertently got some gaps thematically in that space. We are looking at developing some wider communities of practice. So one of those is around coastal communities, and we've got quite a lot of places now where we'll be working with going forwards, that are based on either coastal estuary areas and some commonalities of challenges that those communities face. So I think the good thing about today is that we connect to new faces, new people, but in both directions. And the key going forwards is about how we harness that and bring people into some of those networks, as those spaces. For example, in the next month, we've got 3 sharing and learning events happening across the country, which are seeking to bring new partners and stakeholders to the table to connect. And connection is critical in all of this in terms of building a movement. That's really fundamental to us in each place.
Excellent. Thank you very much, Richard, for the question. Charlotte Hill, and while Charlotte's coming on screen, could one of our 3 presenters look up the chat at a question from Ruth Austin Vincent, because all comes up after to Charlotte. But Charlotte, are you able to come on screen? Go ahead.
Yes, I am. Can you hear me?
Yep.
So I work in Newquay. I run an organisation called Newquay Orchard. We're 7 acres plus 4, and our whole purpose is to improve people's lives through learning and activity, using nature and horticulture as a therapeutic process for that. I think there's always this perception around sport or being physically active. You default to, the more traditional forms of that, and obviously for lots of people, particularly from a health inequalities point of view, that isn't always the first port of choice for people to be looking after themselves. And it's something that we are seeing more and more through the work we do with people across from all walks of life and all sorts of barriers to why their health and well-being or their income may not be as good as it could be. And that whole piece around being outdoors, being able to work with the land, or experience new things through gardening, walking, is so transformational. And when we link that with healthy eating, so grow fresh veg, learn how to cook it, it's affordable, it's good for you, that whole combination is transformational. And so I'm not sure where that is reflected in the Sport England approach. I think I am understanding that there are signs that physical activity is a broad definition, but I'm not sure if there have been lots of examples of how that is built into some of this place-based development work, which I think is an amazing opportunity.
Yes, thanks, Charlotte. 100% agree with you there. And we've learned a lot in that space over the last 6 to 7 years. And we often coin the phrase of start with meeting someone where they're at, and that isn't necessarily a starting point of a conversation around what we might see as formal or informal sport, but it could be someone presenting with a whole range of wider social or other challenges, but the nature of bringing a whole range of different partners and stakeholders together that can provide the best connection, if you like. We often talk about leaving name badges at the door, and let's just think about the individual and what's the lived experience for that individual, and if that is a pathway into your what you do, then fantastic. If that's a pathway into a creative and arts or a wider cultural activity, fantastic. If that's something that we more closely recognise as something more traditional forms, but fine. But let's not preempt that and prejudge that. Let's work with the individual to identify how we socially connect that individual often in the first place. So often the conversation doesn't start with sport, physical activity. It starts with a deeper understanding of where where that person is at. And I think that's the importance of, I've just written down as you were talking, the key here is we can't do this in isolation in terms of one service or partner stakeholder. The success of this is a collaboration, and coming together. And the point around, we've got a video from Birmingham, and in essence the last caption on the video is, you can't stay active very long on an empty stomach, and not being able to put food on the table and heat and light the house. Words to that effect. But it's so significant, isn't it, and so important, because unless we can support people with a deeper understanding of some of those wider barriers, then actually the ability to connect and engage and take on the value of moving more, is something too far away, and too distant in that space. So there is a challenge for us in this, I think, in terms of, we've got a limited resource. Our challenge is, how do we connect other parts of a system locally, other resources, to come together to join forces on responding to what that need is, because the value of what you described, we see time and again in communities up and down the country. I don't know if there's Hannah or Ben, if there's anything you want further to add to that, but
yeah, I was just going to quickly say, Charlotte, I completely agree with you. I think you're exactly right with that. I think our work through some of our partners has been really promising around that. So, for example, our work with the National Academy for Social Prescribing, we know social prescribing, majority of people that will sort of go to see a social prescriber won't go with physical activity as the first thing they wanted to talk about, or the thing that really matters to them the most, but actually making sure that it's part of the conversation, whether it's like sort of a few sessions down the line, or actually sort of being able to bring that in. So I feel like sort of working with the sort of the workforce, whether that's sort of clinical workforce, whether that's physical activity workforce, to be able to enable some of these conversations, I think is really important around that. But yeah, I completely get your point. Being outside, being in nature, we work with lots of partners, so through our active environments team as well, who are sort of predominantly sort of trying to get people outdoors. And also we did put funding into the National Green Social Prescribing Programme to sort of build up some of that evidence base about the benefits of being outdoors, and being active definitely goes hand in hand with that as well. So yeah, I think there is work that's going on as well. It may not be overly explicit, but it's sort of happening at the same time as well. But yeah, I completely agree with you. But it is very much, as Adam says, sort of what matters to the person, I guess, and sort of timing the conversations as well.
And sorry, Adam, just to finish that point, Charlotte, I don't know if you're already connected with Active Cornwall, but if not, then that's definitely something, because we've got some work going on with Active Cornwall at the moment, which will bring this to life a bit more across the county.
Excellent. Thank you very much for that question, Charlotte. Ruth Austin Vincent asked a question before she had to leave, and it's about access to exercise for people with neurological conditions, the need for a targeted approach. She points out that they'll not be the only group that needs such a targeted approach. So kind of what's your view on that targeted approach for people with neurological conditions, and have you seen this built in effectively to place-based interventions? Ben, Hannah, or Adam?
Yeah.
So I'll share my thoughts. I think for me, in terms of the work that I've been involved in, because I've not been involved in most of it, but I touched base with Greater Manchester, I touched base with Calderdale and other bits of and places within West Yorkshire, and for me it is about working with that trusted asset that is already connected to that audience, and getting them to see the value of physical activity to the people that they already connect with, and then ensuring that the sort of wider system leans in to help them to deliver opportunities that could be sustained outside of their contact with that organisation. I'm not sure if I'm explaining myself very well, but so yeah, if there's an organisation already working with people with neurological conditions, I think you start with self, and you actually build in the use of physical activity as part of what you do. So you actually create opportunities. So if they have consultations, it's not across the table, it's having a walk side by side, which is less confrontational, etc. They go out into some green space, so you start to embed it into your practice as an asset. And then for me, it is about convening the assets in that place to say, okay, well, how can you connect to this to provide further opportunities, or for them to try other activities. And that will obviously then involve some capacity building potentially to understand the audience, what any issues that they need to get their heads around in terms of the provision to make it as accessible and as friendly as possible, and as user friendly as possible. So I think it is understanding the audience's needs, but then for me, start with self and then look to connect better with organisations that can help.
Cool. Thank you, Ben. Thank you very much. Again, thank you for the question. So we've only got time for probably 2 more questions left, but thank you, Adam, for saying that you will follow up afterwards. So for the last 2, I'm just going to invite you to be as succinct as possible in asking the questions. Grace, you posted a question early on. Grace Scriven. Are you there, Grace?
Can you hear me?
Yeah, can hear you now.
Yeah,
go ahead.
Great, excellent. So yeah, I'm part of a programme essentially sharing learning and building the evidence base for how combined authorities can improve health and reduce inequalities. So really interested in the work that you've been supporting in Greater Manchester and thinking about how that regional systems comes together and the different players in that system, roles, responsibilities around improving population health. So I was interested to know whether you're developing any specific lessons learned in relation to that pilot area, any learning that we can share across other regions, enablers, challenges, that kind of stuff.
Thanks, Grace. Sorry, Grace, can you just ask you where you're from?
So, well, a programme funded by the Health Foundation working across 10 combined authorities, but led by the West Mids CA.
Okay,
just to be
yes,
confusing.
Yeah. No, that's fine. No, I've landed and positioned the work, which I've got a degree of familiarity with. The reason I ask is, well, it'll be topical for lots of people on the call in terms of devolution and local government reorganisation and any increased responsibilities, powers that Metro mayors may get over time. And obviously we've got a mixed picture, haven't we, at the moment? We've got 10 combined authority Metro mayor areas, of which probably the most advanced in this space would be Greater Manchester. And we're talking to Andy Burnham a couple of weeks ago, was highlighting that they're probably on their 3rd iteration of how they tackle inactivity at a combined authority, wide population area, through to somewhere the approach is or the consideration of the contribution that sport and physical activity can make to wider outcomes at a combined authority level are being discussed and explored at the moment, through to a whole new wave of places coming on board in the coming months. So depending on who's on the call and where you sit, you might be at different ends of that spectrum, if you like. From our point of view, we've taken a huge amount of learning from Greater Manchester. We've got a memorandum of understanding with the combined authority, and obviously the health and social care focus of their devolution has been really impactful and significant in our ambitions here as well. So there's a lot that we can share, and happy to have a follow-up conversation with you offline around that. We are also approaching those other Metro mayor areas at the present time to discuss what would a tackling inactivity action plan look like at the mayoral combined authority level, and how would that add value to what we've described in this call in terms of the kind of work that's going on at a district, borough or unitary authority level. What's the golden thread between those things? Because so much of what we've described here today is about hyperlocal, within communities, and a lot of that sits with a district to borough city council. But then there's so many opportunities at a combined authority level that can add a greater value to and enhance some of that work by bringing the right partners and stakeholders together. And we think mayors have got a really strong convening power in that space, whether that's around active transport, whether that's around Police and Crime Commissioner work and support, whether that's around positioning of integrated care partnerships in in this space. To name, obviously you've got all of the Get Britain Moving, a working agenda that's developing here as well. So it's a work in progress. You can see real opportunities, and it'd be great to have a further conversation with you to deepen that.
Soraya, I can see you on screen here. I'd invite you to ask the question. It was about housing, which I know is an issue that Bob's interested in too. Apologies, Bob. Go ahead.
Hi everyone. Yes, really interested to hear that you're at NAVCA today, Adam, and talking about the leads there. My interest as a trustee for Active Black Country, but also my various roles within housing and working with the Metro Mayor, is around how do we integrate housing into all of this as well, because actually our population of residents are often those that are furthest away from services, and as housing providers and anchor organisations, we're often the first place they come to when they're in crisis. But as you mentioned, if you're in fuel poverty, food poverty, your social capital is really low, actually thinking about physical activity and taking that up might be the furthest thing from your mind. However, it's really important to us in housing because of all the the health benefits, etc. So it's just kind of trying to understand what your thoughts are on housing integrating into all of this as well.
Yeah, thanks, Ray. Again, love to follow up in a conversation with you around that. We are developing a community of practice at the moment around housing associations and housing providers and the role that they have. I mean, ultimately, if we think about the over-indexing of the audience we're talking about here in terms of inactivity and wider inequalities, then the reach that housing associations, housing providers have is really quite significant. So you play a critical role in the reach to connection with audience, and we've been exploring a range of different approaches to that, including the positioning of active lifestyle wellbeing leads within that space, staff training in some of that space. So sort of the concept of every contact counts, and when those structures are connecting with residents, what does that look like? Through to working around what does actually safe and active street scenes and street spaces look like in some communities to support people feeling more safe and secure in moving more, whether that's going down the street for a walk, and coming home in the dark, or something more traditional, more formal in that space. We've got some really good case studies which we can share with you. We've been doing quite a lot of work in for example, in London, in Newham, with L&Q Housing Association, by way of example, and a few others. But yeah, let's bring you in. It'd be great if we could bring you into that conversation and look at how we can collaborate and make sure. So we're investing into the 4 Black Country authorities as part of the announcement today and our expansion work. So timely to be having this conversation, getting on the front foot.
Absolutely.
Excellent.
We are very
networking.
Yes.
Thank you, Soraya. Thanks for the great question. And thank you very much to Adam, to Hannah, and to Ben. Those are excellent presentations. Thank you very much to everyone who posted, asked questions. Great connections being made there as well. So as I said earlier, I'll repeat again, we have been recording the webinar. We will have it up on the platform maybe this afternoon, maybe tomorrow, more likely. And Adam and colleagues will make the slides available also on the platform too. So thank you very much. And hopefully you've enjoyed the webinar. Join us again in about a month's time when the next one in March will join us next time. Thank you very much, everyone. See you again. Bye.